Hello, I'm Portia Young from Milwaukee PBS. You've just watched our documentary, You're Not Alone, about 4 young people sharing their mental health journeys in order to help others. We want to continue the dialogue now on youth mental health in this next half hour. First, I want to give you 2 very important resource numbers if you feel the need to reach a mental health expert directly. The National Suicide Prevention Lifeline is 1-800-273-8255. And the Hope Line, which is a free text-only line, you can text the word Hope Line to 741-741. Hope Line offers free help and emotional support 24/7 for any type of situation. The critical reality of youth mental health here in Wisconsin is the focus of an ongoing series in the Milwaukee Journal Sentinel and the USA Today Network Wisconsin. The lead reporter on Kids in Crisis and co-producer on You're Not Alone is Rory Linnane, who joins us now. And Rory, just a few quick takeaways from your reporting on this important issue and the documentary.
Yeah, thanks for having me. Something that's been really amazing to see throughout this process is just how much of an appetite there is to talk about mental health. So when we first started this series a few years ago, we were worried that people wouldn't even want to share any personal stories with us. But we found that every time someone did share a story, it would inspire another person to share a story. And it's been incredible just to see that ripple effect of more and more people coming forward and wanting to talk about this topic. So I think we've really seen the stigma come down quite a bit around mental health. But at the same time, the services and healthcare haven't really caught up with that. And we still hear from families who are having to drive across the state or ending up on wait lists that can last months, or struggling to find someone that will take their insurance. So there are a lot of kids who aren't able to connect with the care that they need. And I think there's also a lot of work to do on some of the root causes here. So for some mental health challenges, they're really driven by genetics and just the brain chemistry that you got. But for a lot of kids, there are environmental factors that really come into play, such as poverty and racism, incarceration, bullying, academic pressures. There are a lot of different points of stress in kids' lives that are leading to some of these challenges.
Well, that's a perfect segue to our next guest, who is Dr. Jackie Smith from Children's Hospital of Wisconsin. She's a psychologist there, and you're here to help us sort out some of these really difficult questions that I know a lot of people will have regarding youth and mental health. Thank you for being with us.
Thank you.
So as Rory was speaking, we do want to know, for all the parents or young people who may be watching, first off, what are some of the signs that there is an issue with mental health in young people?
You know, I think some of the signs are things that we would typically think of. So having children express a lot of increased sadness or worry, or thoughts of wanting to hurt themselves, take their lives, those I think are more kind of out there. But I think there are some that can be a lot more subtle. And so changes in eating and sleeping habits, not wanting to spend as much time with friends or family, struggling in school, not performing as well in school, sometimes even physical complaints, stomach aches and headaches. Really, you know, if your gut as a caregiver is telling you that something is off, this isn't like your child, that's an important opportunity to take to have a conversation.
And then when people do seek help, I think sometimes they hope that just a prescription or a couple therapy sessions will fix everything. But sometimes it can be kind of more of a lifelong challenge to manage.
You know, I think there are some things that we have very effective treatments for that really do get better relatively quickly, but there are some who will struggle for long periods of time. And I think the important part of that is trying to get them connected to the services that we know are supported by research, the right services at the right time, and continuing to check in with them and not assuming that because they're in therapy or because they're taking a medication that things are just okay, continuing that dialogue and really having there not be shame and still struggling.
So Dr. Smith, how did we get here to this point in our communities, I mean, really across America? How did we get here? We have so many children facing these serious issues.
Yeah. Well, I think that's a multifactorial kind of problem. I think one of the reasons that we are seeing more children facing mental health struggles is that we are doing a better job, or trying to do a better job, of identifying and screening at younger ages in schools and primary care offices and emergency rooms. I think we're identifying the kids who maybe need help at an earlier stage. But then, as Rory pointed out, we're struggling to have all of the services in place that they need, especially for kids who need medications and more intensive types of treatment. We are struggling there.
So perhaps this issue has always been here in our communities. It just wasn't known.
Right. I think it has always been here. And then I think the other piece that you were alluding to, Rory, is that we are a society that is becoming ever driven by technology and social media. And I think for our youth, they are often inundated on social media with what looks like the perfect life of others, when that really may not be the case. And furthermore, if they are facing things like bullying, they don't have a way to escape that the way maybe previous generations could, go home at the end of the school day and have a break. Instead, they may be getting texts or direct messages that are that they're being bullied.
Right. And you may have seen this in your reporting, Rory. As a child, it is much easier to stay in treatment and stay in the medication because the parent can help the child with that. As they age and get into adolescence and adulthood, that becomes that much harder.
I think it can. I think the ways that we try to combat some of those challenges are trying to build habits at a younger age, healthy coping skills, getting to regular appointments when you need to. The more that we focus on building those habits when children are younger, the more likely they are to carry those into adulthood. And then I think the other piece of that is doing that transition slowly over time. So it's not, you turn 18 today, I've done everything for you before, now you're on your own, but slowly building that. I'm going to help you learn how to make appointments. I'm going to help you learn how to get medications refilled. And the more that we transition that over time, it's not such a jarring, scary thing when you turn 18.
All right. Thank you, Dr. Jackie Smith, and thank you, Rory. We will talk later on in the show.
Thank you.
Well, we know that a huge problem for family members is what Rory said, finding that therapist, that psychologist, that psychiatrist to help a child. As Joanne Williams found out, the shortage of mental health professionals has been an issue for a long time and continues to frustrate those in need.
His first episode, he didn't sleep for 2 days. He was experiencing what we now know as hypomania. And here's this boy who was so sweet and so kind and witty and has so many friends, and all of a sudden it just wasn't him anymore.
Her brother was 17 when he developed a bipolar disorder.
This happened a little over a year ago, and at the time we didn't know what was going on. He experienced his first episode, so we brought him to the emergency room, and they sent us home and said, find a psychiatrist.
They live in Waukesha County, but had now entered the new, complicated world of mental illness and healthcare treatment.
With that, we went on our search and kind of got 3 different answers. We either got a psychiatrist isn't accepting new patients, they are not accepting insurance, or there would be a 6 to 9 month wait.
Right now, in our country, we have a serious shortage of child psychiatrists. There are only about 9,000 nationally, and we have a need for at least 32,000. That's been a major shortage in medicine since I was in training, so almost 30 years ago. It was the greatest area of shortage. We haven't made a dent in it.
Dr. John Lerman is the chairman of psychiatry and behavioral medicine at the Medical College of Wisconsin. Unfortunately, many people still believe the stigma that mental illness is a weakness and that psychiatry is not a real form of medicine. Psychiatry can be an emotionally intense specialty, and salaries can play a role in where psychiatrists end up working.
A lot of physicians, it's scary to graduate and go into more of a rural area where you might not be making as much and your family's now $250,000 in debt. Despite
the challenges, some medical students are stepping up, but still, only a few.
Milwaukee.
Here.
This is called Match Day. Medical students all over the country find out at the same time where they will go after graduation to study their specialty. Of the 224 students graduating from the Medical College of Wisconsin this spring, Only 14 chose psychiatry.
49 of our counties, 49 out of our 72 counties do not have a child and adolescent psychiatrist working in those counties. And the average age of our child and adolescent psychiatrists in our state is 51.
So that means that we're going to be losing them as they retire.
Yes.
A new program in which primary care doctors or pediatricians can get help and direction from psychiatrists over the phone is one solution to the shortage. Dr. Lerman sees that as promising.
Currently, we serve 15 northern counties in northern Wisconsin, north of Wausau. We serve the Milwaukee region. We're trying to expand into other areas of southeast Wisconsin, northwest Wisconsin, northeast Wisconsin. We're hoping that the state will expand our budget so we can cover the whole state. That's our goal.
In this whole process, it's been hard because I can't directly help my brother. Besides being supportive and just being there for him, there's not a lot I can do, but I can be an advocate, and I can be an advocate for everyone else that's suffering from a mental illness and help destigmatize, help spread awareness. So for me, this is what I can do.
So families like Brianna's are waiting, with the hope that these brand new doctors from Wisconsin and others from across the country will bring their training and compassion to the places where young people need their help.
That shortfall even has an impact on school counselors and programs trying to fill some of the void. Jennifer Scott joins me now to talk about that. She's a psychotherapist with Children's Hospital of Wisconsin and the Institute for Child and Family Wellbeing. Thank you for being here, Jennifer.
Thank you.
Well, you used to work within a Milwaukee school to help children with some of these mental health issues that they're facing. So how do you help parents deal with some of those challenges that their kids are facing?
Well, you know, therapists really help parents in a lot of different ways. And luckily, schools really are doing different things these days to help support students who have mental health needs. Some of the ways that schools are helping students include things like incorporating social and emotional learning curriculum into classrooms. So doing things like teaching children how to share or how to express their feelings. Other things schools are doing are things like training teachers and school staff on trauma-sensitive approaches with children. So it's really shifting the thinking from what's wrong with you to asking what happened to you, right? And the last example of ways that schools are helping to support children's mental health challenges are bringing in outside agencies and partnering with community agencies to bring in those mental health providers. And this is happening all across Wisconsin, so it's really nice to see.
Well, is that enough for schools to be doing that type of curriculum and those different tactics, if you will?
Right. You know, from my experience, I think schools are trying the best that they can with the resources that they have. I think it's really important to understand that with mental health, a lot of people who have mental health problems, it's rooted in early childhood trauma. And it's really a larger public health issue than schools alone can address. And trauma stems from something we call adverse childhood experiences, or ACEs.
So tell me more about that. What are ACEs? Is it something parents, what do they need to know?
So there's a lot about ACEs, and for more information, you should check out the Institute for Child and Family Wellbeing website. But in general, ACEs, or adverse childhood experiences, are things like growing up and having a parent who's incarcerated, having a parent with a diagnosis, mental health diagnosis or substance use diagnosis, experiencing physical abuse or neglect, emotional abuse or neglect, sexual abuse, lots of things like that. What we know about ACEs is that the more ACEs someone has, the greater risk throughout your life of experiencing a whole host of problems, chronic disease, even dying earlier. You know, I think one statistic that really stands out is that we know that if someone has 4 or more of these adverse childhood experiences, they're going to be 12 times more likely to end their own life. But there's good news, though. Not everyone who experiences ACEs is doomed. Children are resilient, right? Like Raina in our documentary. And if they're, hooked up with the right services, that can really help. And ACEs are preventable. So what we really need is a multi-systemic approach. We can't rely on schools alone. We really need to be targeting those early childhood experiences, healthcare, education, and increasing parenting.
Well, with that, quickly, what are some tips that parents can use when they're working with their teachers in schools?
Right, definitely. So I have 3 really quick tips if you're a parent who has a child and you're having some mental health concerns. One is to work with your child to identify a support team at school. This could include a trusted teacher, a friend, a coach, but this will give the child an opportunity to feel more comfortable in school and know that they have someone to talk to. Okay. The second tip is, especially if you have a child who is in therapy, be the bridge between the therapist and the school. So really understand what are those coping skills, what are those tools your child is learning in therapy, and then work with your child to talk with their team at school about what are those skills and use the same language. And lastly, if you're concerned that your child's mental health issues are interrupting their ability to learn, really make sure to try to connect with that teacher. And if it's not the teacher, the school psychologist, the social worker, the counselor, share your concerns and work together to create a plan, and they may suggest additional things you don't even know about that the school offers.
All right, Jennifer Scott, thank you for being with us.
Thank you.
Thank you. She is from the Children's Hospital of Wisconsin and the Institute for Child and Family Wellbeing. We talked about some key signs of mental challenges. Parents or guardians, they handle it in all various ways. Here's what the parents of Alex and TJ had to say.
I dealt with mental health issues and depression and suicide. And as a parent, I've got to see it now from 2 different perspectives. And that's why I was able to manage and understand and see his traits a lot sooner. And as soon as I seen okay, something's wrong here, we need to do something. You see when your friends are sad or they're disconnecting themselves or they're not interested or happy about the things that they used to be happy about. We all see those red flags, and that at that moment is when you need to be like, hey, what's up? What's going on?
As I learned very quickly, gender and sexuality are totally different things. And, coming to that, you just don't know when you're uneducated.
TJ helped educate us quite a bit. And then as well as us doing a lot of research and talking to people and getting into networks and talking to other parents and other kids.
Joining me now are the parents of Barrett, who was featured in our documentary, Becky and David Petker. Thank you very much for being with us.
Thank you.
So we heard from Alex and TJ's parents. Not every child, though, unfortunately, has the support that seems to be a thread that has been in our documentary. Barrett definitely had your support. Can you talk about how you came to that moment? Because it's not always easy for parents to get there.
Yeah, I think our biggest thing was show up. And by that I mean, be at her games, help her with schoolwork, keeping a game face, kind of let nothing surprise us till she walked away, and then we got together and figured out a plan. We had a special code word that if she was uncomfortable in a situation, she could text us or call us from school, and I knew that was our, that was kind of her way of saying, I need help and I need to get out of here. Sometimes it was physically laying on top of her at night. We did nightly check-ins with her, I think. Another thing is we had a fantastic therapist who she started with very young. In our house, we believe in mental health just as physical health, mental health. And so we're very open about that. I think that we talk about it very openly amongst our family, our extended family, friends, everyone.
I know there are parents watching, though, that say, this is good, you're on the other side. But in the very beginning, when you were seeing these things, human nature is to say, I'm not really seeing them. How did you deal with that?
Well, it was hard. Becky and I weren't always on the same page with that. Barrett was doing well in school and she was doing well in sports, and so it was easy to say, well, these problems that she's bringing up at school must not be that bad because it's not impacting her. And so it took a while for us to talk and really get on the same page and really start focusing on the core of the issues.
And that alignment, I mean, that probably affected your relationship too.
It
mean,
did.
so how do you navigate, you're trying to deal with this child who's in crisis, but at the same time, keep your marriage together?
Ugh.
I mean, it's difficult.
I think it was, yeah, I think we like each other.
Yeah.
Okay.
That's helpful. But I think that we just, our biggest goal was, we wanted her to grow healthy and strong. And so how are we going to do this? And so we had to come up with plans. We'd come up with plans at night, and we fumbled sometimes, those plans. But, you know, with the help of, I think her therapist was an interpreter for us, and so that was helpful, I think, for us. And then we would just get together and kind of talk
just being
about it.
open and willing to talk about it. Obviously, we had the same goals in mind, and so we just figured out ways that we could achieve those.
Okay. Well, you certainly dealt with bullying with Barrett and this issue in school. So from your perspective, what's working in schools and what's not working when an issue of bullying?
I don't know everything that they're doing. I know that one of the things I think that is not working is the so-called zero tolerance policy. A lot of times these schools say that they have zero tolerance, but then the bullying occurs and there's no disciplinary actions towards the bullies. And I think that sends the wrong message.
Any tips that you could share if there were a manual that you could write, and now that you are on this side of it, you're still very much in it, it never goes away.
Right.
What could you tell a parent who's watching right now?
I think for us, the important thing is to use the words. Are you okay? We needed to ask the question, be prepared for the answer, no matter what that answer was. So we used words like suicide and harm. Are you feel like harming yourself? It's okay to not be okay, but you need to tell us that. So I think that were some key things that even when Barrett looks back on it, she says, yeah, that was really helpful. At the time, you know, and it's hard to look at your 10-year-old and your 12-year-old or 16-year-old and say, do you feel like harming yourself? Do you feel like suicide? Are you having thoughts? And it's hard, but you kind of swallow it. Just take a deep breath and wait for the answer and then make a plan.
So today you are on a road, on a journey. How do you stay with the forward movement?
Communication. Just keep asking the questions over and over. Make sure you stay on them and encourage them to share whatever they can with you, and not rest on your laurels and get complacent. Just keep talking.
She's really brave. She's taught us to be brave. She's taught us to not be shy. She's really resilient. So I think that she's taught us a lot too through all this.
All right. Thank you very much, David and Becky
Thank you for
Pecker.
having
Thank
us.
you very much for sharing your story. Well, we do want to say that again, there are cultural and specializational areas for everyone to consider, especially for a diverse youth dealing with mental health issues. During a recent show here on Milwaukee PBS, 2 mental health experts spoke about the challenges that children of color often face that can often lead to suicide.
When youth experience racial discrimination, it's a difficult thing to deal with. It's a difficult thing also to express, and sometimes their behavior may be things that may not be socially acceptable, and it's also difficult to make sense of for yourself. You may not like me because of what I'm wearing or my glasses. That's something I can change. I can't change the color of my skin.
I came across a study, a report in Science News. It basically says suicide rates for children ages 5 to 12 are roughly twice as high for black children as for white children. But that number reverses when kids hit the age of 13 to 17. Why is that?
Children specifically in the inner city have PTSD, post-traumatic stress disorder levels as high as children who are living in the Middle East, as high as soldiers returning from those combat areas. And when you go through that day-to-day struggles but don't have the cognitive ability to understand how to deal with it, you will think about things like suicide.
Many issues to consider. Dr. Smith joins us once again, and you do work with gender diverse youth. What is the most important thing for a parent or guardian or caregiver? What can they do in these cases?
The number one thing I think is to be open to having conversations, and trying to be as non-judgmental as you can, even if you don't understand where your child's coming from, even if you don't agree. Opening the door and listening, we know, is one of the most protective factors against depression and suicide in LGBT plus youth. If they are in situations where they feel supported by family members and schools and communities, we see, dramatic decreases in those symptoms. So listening is really the number one thing you can do.
So listening, that's part of it, but the understanding is much, much more difficult for many parents. How do you get to that point?
Time and ongoing hard conversations. I don't think that there's a one-step approach to handling such a complex issue. But being willing to revisit that and not just push it under the rug and say that's going to go away or we're not going to talk about it. I think that's where we see youth really struggling.
And we did hear from TJ in the documentary, crediting his family's support for helping them with this smooth transition. So with that, have things changed for LGBTQ youth?
I think they're definitely changing. I think there is ongoing awareness, greater awareness that is happening for our gender and sexual orientation diverse children. I think we're having more conversations within families. We certainly are seeing more in media and social media and in schools and doctors' offices. And the more that we have those conversations, the more that we are finding youth are willing to step up and tell us what's going on for them and share their experiences. And so I don't think that this is something that is just incredibly on the rise. I think we are just talking about it more.
Okay, and the stigma, here it seems like it is that twofold, because you have the mental health issue and then the stigma of perhaps not understanding LGBTQ issues.
Right.
So bridging that divide, is it really an education exercise for caregivers?
I think it's education. I think it often involves, caregivers working through their own beliefs and, how they understand gender and sexual orientation and addressing some of their own kind of biases head on at times. And that's a process. You imagine a life for your child, and when things don't go the way that you sort of envision for them, that can be incredibly difficult.
Well, with that said, how do you how do you help them let go of those dreams? I mean, we're all, I'm a parent, and yes, I have this vision of what I think will happen.
Right.
But that's very hard. How do you help them through that?
I think a lot of it is learning how to focus on the here and now, and even listening to the parents who were just speaking talk about, we asked the hard questions, we heard the hard answers at times, and we figured out a plan. And I think it's a constant reiteration of that, and not trying to get too far ahead of yourself into the what ifs, because none of us have a crystal ball to know what's going to happen.
Right. All right. Thank you, Dr. Jackie Smith from Children's Hospital of Wisconsin. Thank you. As we are wrapping up our discussion, I do want to let you know that Milwaukee PBS and the Milwaukee Journal Sentinel have produced a toolkit along with a series of web stories to help you continue the dialogue on youth mental health, whether at home or in schools. Go to MilwaukeePBS.org or jsonline.com/you're not alone. Within the toolkit, you can request a free DVD copy of the documentary, You're Not Alone. Rory Lenane joins us once again to talk a little bit more about this toolkit and also to share some of her final thoughts about this topic. And Rory, again, you've been covering this for 3.5 years. First, let's get to your initial final thoughts about what you've learned during this process.
Sure. Yeah, I've just learned how important it is to keep those conversations open. And as we were hearing from the parents earlier, how important it is to say all of those words that you might not be comfortable with talking about at first, and asking the questions of your kids. Because if you're not comfortable, then it's going to be really hard for the kid to be comfortable coming forward. So just continuing those conversations.
Okay. And the toolkit?
Yeah, so the actual documentary we kept to only 30 minutes because we wanted it to be something that teachers could use in their classrooms. So there's a lot more information that we weren't able to squeeze into those 30 minutes, and online through the toolkit you can go more in depth into different types of different subtopics, like the LGBT considerations you were just talking about. So there are extra videos and discussion questions and text, and a whole resource list that can help you connect with mental health care, get more education, or just get involved in your community.
All right, thank you. Once again, I do want to share those resource numbers with you. The National Suicide Prevention Lifeline is 1-800-273-8255. 8255. And the Hope line, which is a text-only line, you can text the word Hope line to 741-741. Hope line offers free help, emotional support 24/7 for any type of situation. Thank you to Rory Lenane of the Milwaukee Journal Sentinel for all of your work on Kids in Crisis. You're not alone. Thank you for your reporting. We do plan to keep this dialogue going on youth and mental health here on Milwaukee PBS. For now, thank you all for joining us here on Milwaukee PBS. And for Kids in Crisis, you're not alone.